Namaste and warm greetings to every single one of you. I apologize for not being here in person, but it is a very personal reason. I've just become a grandmother, and it was a moment I wanted to share with my family and be here in person. But I must admit, it is an honor to be amongst you, albeit virtually, because you communicators, change makers, and visionaries are people who understand that reputation is not just built in campaign rooms, but in corridors of policy, and in classrooms, in hospitals, in marketplaces, in homes. And we must look at a 360-degree dimension to this important aspect of reputation. And as we mark 25 years of PRCAI and celebrate India's rise through innovation, sustainability, and entrepreneurship, I want to offer you another lens through which to view India's ascent, and that is the lens of healthcare. Not just as a service industry, but as a cornerstone to India's global reputation. I think the way a nation treats its most vulnerable and the way a nation commits to bring healthcare within the reach of everyone reflects its character. And India is beginning to be known now globally for science, scale, speed, connectivity, technology. But let us reflect and let us project our ethos of care, our belief that every life matters. And that is something which has turned healthcare into something which is bigger than a service industry. And over the last few decades, India has transformed healthcare into a cornerstone of its global identity. And I'm proud and happy to say that, Apollo, we started over 43 years ago. At that time, my father, Dr. Reddy, began because he wanted to bring healthcare within the reach of people. He had lost a young patient who didn't have the time and the money to go abroad for treatment. And looking at his wife and young children, he vowed that we should bring healthcare within the reach of everyone. Today, patients from over 140 countries travel to India for treatment. And that's not just medical tourism. It's global trust in Indian hands. It's in Indian hearts, in Indian systems, and it's bringing us pride and respect in the global space. We've become known for our excellence, but increasingly we're becoming now known for something deeper, and that's our ability to blend clinical innovation with human dignity and care. And the pulse of today, the current landscape in India, is a story of paradoxes, because we've made incredible strides. We've reduced maternal and infant mortality. We've expanded health insurance coverage to cover more than 60% of the population. We've accelerated digital adoption. And now we're delivering global standard world-class outcomes at 1/10 of global costs. And yet, we also know the reality. Access isn't uniform. People in many parts of the country and in some economic sections are denied healthcare, and affordability is still a struggle for many, and quality is uneven even in the Indian borders. But there's one thing that the world is watching, and that is how we got here, where we're going, and the speed at which we are doing things. Because every teleconsultation that reaches a remote village, and every child who survives due to a timely diagnosis, and every innovation that's made accessible is a signal. It's a signal to the world saying that we are a country who cares. And this is what is shaping another dimension of the story of India. I remember so clearly when we did our first telemedicine transaction in the year 2000 when Bill Clinton was visiting. And at that time, we actually, this was part of an outreach program that we were doing in my father's village. He had put up a 100-bed hospital. We worked on what I believe is the country's first comprehensive health insurance, because all 7,000 people in that village cluster were covered, and they got a passport to health for 1 rupee a day. And we went door to door literally and said, for the price of your coffee or your BD, can you please put that money aside and we will give you complete health coverage. But that is history. Today, that center, which offered telemedicine when Bill Clinton visited, that center has preventive health care. It has women empowerment models. It has all the social determinants of health, clean drinking water, sanitation, and is an integrated total health model. And this total health model is something that the Harvard University has written a case study on. The University of Singapore has looked at. And most gratifyingly, in a recent survey which was done by the collector, the incidence of non-communicable disease was significantly lower in this cohort where we have focused on primary and preventive healthcare. It was significantly lower than even the neighboring villages and districts who have a similar geography and a similar etiology. So there are models which are now proving that we can reduce the burden of disease, and at the same breath, we're offering the most advanced care to people at 1/10 of global prices. So this is what I think is the framework of care that we can not only deliver in our country at scale everywhere. This is the human-centered excellence that we must showcase to the world and say, can we help new economies, not, whether it's Africa or Indonesia or many parts of the world, and talk about holistic rural health programs where they access clean water, nutrition, and work on early detection, integrate yoga and good food into their daily lives, and public-private partnerships that go beyond buildings but into measurable outcomes of care, and massive digital ecosystems that connect frontline workers. And in today's world, longitudinal tracking of health and not just episodic interventions, and then layering AI on top of this. This is a time in the history of the world that we can dream. We can dream of a world without cancer. We can dream of finding a cure. We can learn. We can learn from telecom. We can learn from leapfrogging advantages. And we can use the unique gifts that India has. Our national health stack, our public APIs, our data sharing frameworks. All these are laying a silent and very powerful foundation for the UPI of global healthcare, which is secure, ethical, inclusive, and comprehensive. Drawing inspiration from Peter Diamandis, let us remember that technology isn't here to replace us, it's here to augment us. In healthcare, this means AI for early diagnosis. It means remote monitoring that reaches beyond the doctor's reach, but even a nurse or a technician can interpret the first layer because the technology has been created using a doctor's knowledge. It means digital tools that reduce friction and increase trust. It means our ability to serve on the top of the Himalayas like we have been doing for the last 7 years. So let's not be afraid of disruption, and let's design for care and for dignity. Healthcare should leapfrog with digital diagnostics, remote monitoring, AI-powered triaging, and all grounded in a human-centric delivery model, not just for tech's sake, but for the sake of trust and transformation. The future is now. The future is now when biology is meeting AI. And I could talk so much about this, but I know that you have 100 other things going on today. But let me assure you that the future isn't far off, and it will be inclusive. But there are just two more quick things I want to share with you. One is that whatever we're doing, let's do for 1 billion people. And we jokingly say we're doing it for 1 billion people, not just for the billionaires of this country. And equity will be hard-coded into our algorithms. So these two things I wanted to speak about. Number one is preventive healthcare. Please remember, one of the most amazing ecosystems, the most amazing machine, the most incredible creation is you, is your body. And this body gives out signals. We need to pick up those signals in early diagnosis and prevent the onslaught of major disease. So when we find a heart problem, I want to find it when the calcium score is just beginning and not when 4 vessels of the heart are blocked and somebody needs to rush into the emergency room with an MI. If we're finding cancer, let's find it in stage 1 at the early stage, because today's diagnostic blood test, at Apollo Diagnostic, we're doing early detection blood tests so that you can find these early symptoms. And we've coordinated and brought this all together into an integrated, proactive, preventive healthcare ecosystem called ProHealth. So please have your comprehensive health checkups. The second important one that I cannot leave any stage without mentioning is that women are the architects of healthcare and women are the future of the world. And so let's be honest, no healthcare system can function without women. And I don't mean me or any of us, my sisters. I'm talking about women as caregivers, women as healthcare workers, women as nurses, scientists, doctors. Yet the discrepancy or the inequity in the access for women to healthcare is significant. So we must empower women in healthcare, appreciate them, but also ensure that women have 100% coverage to healthcare. So finally, let's imagine a world where India leads in global standards for ethical AI in health, where every Indian has access to healthcare and our telehealth models are being scaled across the global south, where we export not just medicines as the pharmacy to the world, but we export medical values and comprehensive integrated medicine, which includes age-old knowledge of Ayurveda, etc. And we create South-South alliances for shared healthcare systems. But finally, we're also the moral compass for global health diplomacy. And as important people who are shaping the narrative across the country, we often speak of GDP, of per capita income, of foreign investments. But reputation isn't built by numbers alone. So please go out and tell everybody, tell our policymakers, tell your leaders of your companies that let's talk about India's role in healthcare, and let's talk about healthcare to our own employees and our own people and our own families, because that's when all development becomes comprehensive and integrated. And we have something wonderful that we want to share with the world and that the world can see. And most significantly, let me end by wishing every single one of you the health and the power to do what you dream of doing to make the world a better place, because that's why we were born. Thank you all so much, and namaste.